If you're over 60 and care about your heart health, this video might just change how you think about fruit. You probably grew up hearing, "Eat more fruit to stay healthy." And that advice is true most of the time. But here's a surprising truth that few talk about. Some fruits can actually interfere with your cholesterol levels and medications, sometimes dangerously. If you're a senior watching this, what you eat could silently affect your heart in ways you don't expect. Imagine this. You've been carefully managing your cholesterol with medicine and diet, but one common fruit sneaks into your daily meals, and suddenly your cholesterol drops too low, or your medication becomes less effective. It's not just about avoiding junk food. Some healthy fruits contain compounds that interact with your body and the medications you take. This is especially true if you have heart conditions or take statins or blood thinners. Today, I'm going to walk you through the top 5 fruits. Seniors should be cautious about fruits that might lower your cholesterol or interfere with your heart medications more than you realize. These fruits aren't bad, but understanding their effects can help you stay safe and keep your heart strong. So stay with me, because if you or a loved one is over 60 and taking heart medications, this could be life-changing information. Number 1, grapefruit. The famous medication interactor. Grapefruit is probably the best-known fruit for causing trouble with heart meds. It contains compounds called furanocoumarins that interfere with enzymes in your liver, responsible for breaking down many drugs, including statins used to lower cholesterol. Why does this matter? When you eat grapefruit or drink grapefruit juice, these compounds block your liver's ability to metabolize statins properly. That causes the medication to build up in your blood to dangerously high levels, increasing the risk of side effects like muscle pain, liver damage, or even rhabdomyolysis, a rare but serious condition where muscle tissue breaks down. A 2017 study found that even small amounts of grapefruit juice significantly increased blood levels of simvastatin, a common statin. For seniors whose liver and kidney function may already be declining, this effect can be amplified. If you're taking statins like atorvastatin, simvastatin, or lovastatin, it's best to avoid grapefruit completely. Alternatives like orange or apple juice don't have this effect. Number 2, pomegranate. The hidden blood thinner. Pomegranate juice has been praised for its antioxidant and heart benefits. But if you're on blood thinners like warfarin or newer anticoagulants, pomegranate could cause unexpected bleeding. Pomegranate contains natural compounds that may increase the effects of blood thinners by inhibiting the enzymes that break down these medications. This can thin your blood too much, increasing the risk of bruising, nosebleeds, or worse, internal bleeding. A case report published in 2015 described an elderly man who experienced excessive bleeding after drinking large amounts of pomegranate juice while on warfarin. His blood tests showed dangerously high anticoagulation levels. So while pomegranate in moderation is healthy, if you're on blood thinners, it's crucial to talk to your doctor before adding pomegranate juice or extracts to your diet. Number 3, avocado. Great fat, but watch your statins. Avocados are full of heart-healthy monounsaturated fats, fiber, and potassium. But for seniors on statins, avocado can interact in subtle ways. Avocado is rich in vitamin K, which plays a key role in blood clotting. If you're also on blood thinners like warfarin, too much vitamin K from avocado can reduce the effectiveness of your medication, increasing your risk for dangerous clots. While avocado doesn't directly lower cholesterol, dangerously, combining high vitamin K intake with blood thinners requires careful balance. Many seniors don't realize this and eat avocados daily, unknowingly changing their medication effect. The best approach is consistent intake. Don't suddenly increase or decrease avocado servings without consulting your healthcare provider, so your medication dose can be adjusted properly. Number 4, cranberries. Powerful, but potentially risky. Cranberry juice is well known for preventing urinary tract infections and providing antioxidants. But for seniors taking blood thinners, cranberries can be a double-edged sword. Like pomegranate, cranberries contain compounds that can inhibit enzymes involved in metabolizing warfarin and other anticoagulants. This may lead to an increased blood thinning effect and a higher risk of bleeding. Several case studies link cranberry juice consumption with unexpected bleeding in patients on warfarin. While more research is needed, the risk is real enough that many doctors advise moderation. If you're a senior on blood thinners, enjoy cranberries occasionally, but avoid drinking large quantities daily. Number 5, star fruit. A dangerous choice for kidney and heart patients. Star fruit might not be as common as the others, but it's important to mention for seniors with kidney issues and heart conditions. Star fruit contains neurotoxins that healthy kidneys usually filter out. But in seniors with reduced kidney function, these toxins build up and can cause severe neurological symptoms, including confusion, seizures, and even death. For those taking medications for high blood pressure or heart failure, the risk is even greater because star fruit can affect potassium levels and interact with certain drugs. If you have any kidney problems or heart conditions and are over 60, it's safest to avoid star fruit altogether. Why these fruits matter more for seniors. As we age, our bodies change in ways that affect how we process food and medicine. Our liver and kidneys slow down, making it harder to clear drugs and toxins. Blood vessel walls stiffen and may have plaque buildup, raising stroke and heart attack risk. Medications like statins, blood thinners, and blood pressure drugs become essential, but can interact with compounds in certain fruits. Nutrient absorption fluctuates, meaning vitamin and mineral levels affect drug actions more intensely. This delicate balance means that even healthy foods need to be carefully considered. What was good for you at 30 might be risky at 70, especially when combined with medication. Helpful tips for seniors to safely enjoy fruit. Always tell your doctor or pharmacist about everything you eat regularly, especially fruits and juices. They can check for interactions with your meds. Never make big changes to your diet suddenly. Consistency helps your body and your doctor adjust medications properly. Use fresh whole fruits rather than juices whenever possible. Juices concentrate compounds and sugars, increasing risks. Monitor for unusual symptoms like bruising, muscle pain, dizziness, or confusion, and report them promptly. Keep a food diary to track your fruit intake and any symptoms or medication changes. Consider routine blood tests to check medication levels and adjust doses if needed. Stay hydrated and maintain balanced nutrition for heart health. In conclusion, fruit is generally healthy, but for seniors, some fruits can interfere with cholesterol levels and heart medications in surprising ways. Grapefruit, pomegranate, avocado, cranberries, and star fruit deserve special attention. If you're over 60 and managing heart health, always consult your healthcare provider before adding or removing these fruits from your diet, especially if you're on statins, blood thinners, or blood pressure medications. Your heart depends not just on what you eat, but on how your body handles those foods. If you found this video helpful, please let me know in the comments. And remember, staying informed is the best way to keep your heart healthy and your independence strong.